Good afternoon, everyone. Thank you for being here, Christine Beyer. My name is April DiPietro, and I'm the Community Resource Director at the Camden County Partnership for Children. I am also on the Planning Committee for the New Jersey Youth Intellectual Developmental Disabilities Transition Conference. This is our 4th year. We are very excited to have the support of the Commissioner with us, and we're going to go through a few questions today. Thank you for being
great.
here.
Thank you for having me. I appreciate the opportunity.
Excellent. So as Commissioner, what would you like the New Jersey Youth Transition Conference participants to know about your administration and who you are?
I think what I would hope people think about and know about this administration is how committed we are to the families that we serve and to the young people that we serve. And I think if nothing else, a lot of the work that's been done over the last 6.5 years in this administration is to really center family voice and youth voice and bring about the experiences of people who have gone through programs and services with DCF, and that we're listening to improve those services. But I think it's the commitment and how much we really care about the families and youth in New Jersey.
That's awesome. In what ways do you think that the YTC has impacted the lives of people living with intellectual developmental disabilities across our great state?
Yeah, I mean, I think what's so great about YTC is the opportunity to bring together young people, their caregivers, providers, and advocates, and in a space to be able to really think about and plan for youth who are transitioning, and really centering lived experience and kind of bringing the wisdom of lived experience to that table to improve outcomes, to identify services, challenges, and opportunities to help ease the transition into adulthood, which can be sometimes scary and a challenging time, both for the young person and for their family. But I think that's it. It's like just creating this space for the opportunities to raise issues and solve together.
Yeah. Are there any initiatives under your administration that you would like to highlight related to the IDD community, specifically those going through the transition process?
Yeah, I mean, I had to write a few things down. So, but I think, first and foremost, I would say that when we came in this administration, one of the things that I had said to our CSOC leadership was that we really needed to pay attention more intentionally to youth with intellectual and developmental disabilities and the needs of their families. And honestly, it was something that I did not have a lot of experience in myself, and so maybe it was, I felt like I needed to learn and wanted to learn more, and so then I was just projecting that, onto my team and the leadership within CSOC. And I think we have done a good job. I think there's still a long way to go. But we have established an IDD liaison within the children's system of care, and that position is there to really support youth and families with intellectual developmental disability needs, and helping them navigate the services of the children's system of care, which I think then includes navigating out of the children's system of care into the adult system. So that's one thing that we did. And then I think, recently we initiated the intensive mobile treatment services pilot in 2 counties. And that pilot was conceived as an alternative to residential care for youth with intellectual and developmental disabilities with severe challenging behaviors and or kind of the co-occurring physical and behavioral health challenges. And so that program was designed to assist youth with behavioral and psychiatric needs with evidence-based practice to improve the youth's ability to function, cope, thrive in their home and community. And the program also includes a 24-hour crisis intervention component, like our mobile response service. And so I have a lot of hope for that program because, our goal is always to try and keep individuals in the least restrictive settings possible. And I know how hard it is sometimes for families also when they want to keep their child at home and are not able to do so because they don't have the services or they don't have the support that they need to do so. And so I think this program already we're seeing some good results from the pilots that, there's a possibility that this is something that I think could help provide that intensive level of care that someone who otherwise would require, a residential treatment. So through DCF's system of care, we've really prioritized two-way communication of information around the transition process. And I know that it is really difficult, and I probably will say that another 10 times during, the time that we're talking, because I know how hard it is. And yet we can help make it smoother. And I think that the CSOC team has recently, been working on conducting both internal and external trainings around transition for our partners within DCP&P, so within our own department. It's like, how do we cross-train our staff, as well as trainings around guardianship and transition for our CMOs, our care management organizations. And they created a transition desk guide for our provider network to use with families to ensure that all families receive similar information about the process, no matter where they access the system or how they're accessing that. Understood. And then I think that also goes along with a lot of work that CSOC has been trying to do with DDD. Yeah. And really, I think we do have a good relationship with the Department of Human Services, and there's definitely an interest and a desire for us to work more closely to really try and ease that transition.
That's awesome. In what ways do you think the conference enhances or supports your vision for the IDD youth transitioning into adult services?
I think that the conference is really an opportunity. Well, it's a place that we can bring challenges and opportunities, right? It's a forum where we can present new information, we can present new best practices, we can talk about, we can talk about the challenges we're experiencing, because we do experience challenges. We don't always want to make everything hard, right?
Yeah.
Our intent is not to make it harder, although I think a lot of people think that's the role of government. That's not true. But sometimes we don't know what needs to change, or we don't know what's the most effective way to change something, or to just ease a process without hearing from families. And so the opportunity then that the conference provides is to be able to hear from families and to hear directly about what some of those challenges are, and to get information about what they think we could be doing differently or better. And I think that's how ultimately we're going to grow the strongest network, I think, to be able to really support youth transitioning.
Excellent, thank you. What is your personal favorite part about the YTC, and what makes you continue to support our efforts?
Well, I think.
Oh, shucks.
There's a lot of great people behind the conference and the YTC, and so I, not joking when I say that, because there's a lot of energy and a lot of enthusiasm, and so I'm all about that, and we really want to have everybody who's participating feel that same, level of energy and commitment. I like the idea that it's virtual, that I know it started during COVID, right, when we had no choice but to be virtual. But the fact that you continue that platform so that it is about inclusivity and accessibility, and that it really then allows for anyone who wants to participate to be able to participate almost without barriers. And that it just gives the platform for people to be able to participate and learn, and that you provide a lot of good information.
It's our goal.
Yeah.
What we're working towards. Thank you for that. In your experience, what would you like parents and young adults to know about the transition process that you feel should be known sooner rather than later?
So I asked our staff this question because I wanted to make sure that it wasn't just what I think, but
Right.
that, what are the staff within the children's system of care hearing repeatedly from families about, what we want people to know, and sooner rather than later. And that's about the need for eligibility. And, that everyone should be aware of that we want everyone to understand that eligibility should be established as early as possible to prepare for a smooth transition to the adult DDD services. And, we want families to utilize the support of the provider network to navigate sometimes complex and confusing processes, and that communication is really key. And so as eligibility, first and foremost, as early as possible, and that, if you're communicating, the families are communicating if they're having challenges, whether that's to their child and family team through the CMO, whether that's to calling CSOC directly, but, there are people here who want to help and just keep communicating with us.
Does your administration have anything planned to enhance the transition process for parents and young adults, like anything in the pipeline?
Yeah, I think it's just around communication and really trying to improve communication around that process for youth with high needs that are preparing to transition from CSOC care into adult residential services. We've specifically been working with the CMOs and trying to strengthen communication between the child and family teams, the Division of Developmental Disabilities, and CSOC, just to ensure that that the transition planning begins early, and that not only, I'm saying in the previous answer that we want families to communicate with us, but we are trying to communicate not just better, but I think more effectively and efficiently for families.
Excellent. For all the young adults transitioning this upcoming year, what message do you have for them?
I think, I'm going to answer this from my own experience, which is a little bit different, but I just transitioned my son into college this year. And it is different, but there's still the challenges of launching from being a teen and into being a young adult, and that there's a lot of support I think that's needed. And what I said to my son, and what I would encourage all of the young people who are transitioning, is to ask for support. Yeah. If you feel stressed, it could be one day you don't need us, and the next day you do. Okay. And that it's okay. It's okay to ask for help. It's okay to ask for support. In fact, we encourage that as parents, as caregivers, as providers and advocates. Like, we really want to be there to help catch people when they start to slip, and that you have a safety net. You don't have to do it on your own. There's nothing to prove to anybody, right? We just want you to be successful, and so do not be afraid to reach out and ask for help if you need it.
And the last question I have for you today is there anything that the YTC or the general community of service providers can do to help DCF meet the growing needs of individual support services, specifically assistance with the ADLs?
I think what I would say to that is, as CSOC is kind of growing our resources, and I would ask that you and other providers, advocates, could encourage the distribution and the dissemination of that information, that we are growing our provider network, and so there are opportunities for people to get involved and to get connected with us or to have contracts with us. And so I think it's just asking that we spread the word and continue, we will share what's new and developing and when opportunities arise, and just that the provider network continues to expand through sharing with others, and again, keeping the lines of communication open.
Excellent. Well, thank you so much. I appreciate it. being able to hear from you and to speak to our participants for this year's conference. I think it sheds some light on what the division is looking to do and what the conference, on behalf of the Planning Committee, thank you.
Thank you. Thank you for having me.